back to my YouTube channel. If you're here for the first time, hi, my name is Busari and I'm a registered nurse and midwife based in Nigeria. Here on this channel, I film about nursing and healthcare, and today I'm going to be talking about methods of contraception. Previously on this channel, I've actually filmed about the natural method of contraception and the use of condom, but today I'm going to be diving into all available methods of contraception, and for that I actually borrowed a material from my clinic which is going to help me out with the whole health education kind of thing. So if you want to learn about it, you might want to watch this video to the very end. So guys, this is the board that is going to guide me through this process today. I hope you guys can see. So to start with, we have the calendar method for contraception. We also have the cycle bead method, which are basically the whole mechanism behind it is that you have to know periods where you're safe, meaning periods where you're not ovulating or you're not likely to get pregnant. If you want to know how to calculate your safe period, I'm going to put the links to the video up here so that you guys can watch it later on. Then another natural method of contraception is the withdrawal method, also known as coitus interruptus. Basically, the whole mechanism behind that is that the man does not deposit the semen into the female reproductive tract, like the vagina basically. So the man doesn't have to deposit the semen there, and with all that the woman doesn't get pregnant. I'm trying to rush the natural method because that's not really what we are here to talk about today. I know most of you are here to learn more of the artificial methods. So first, for the artificial methods, I have condom on the first number one of the list, and you have the male type and the female type. Let me see if you guys will be able to, yeah, see, this is the female condom, this is what it looks like, and here is the male condom. So you have male, female, female, male, male, female. So I hope you guys can see. So that's that about condoms. I actually have a video on use of condoms, so I'm just going to link it up here for you guys to watch. I also spoke about the advantages of using condom over other methods of contraception, artificial methods this time, because it kind of has a dual purpose. Apart from the fact that it's going to prevent you from getting pregnant, it's also going to prevent you from I don't know, getting STIs. Sorry for using the word I don't know. I'm just trying to relax because I've been busy on the word today, so it's kind of I'm kind of really stressed. So basically, condom does two things. It's going to prevent you from getting pregnant, and it's also going to prevent transmission of STIs like gonorrhea, syphilis, and all that. The other advantages of the use of condom are on the video I mentioned earlier. So apart from the natural methods I've mentioned earlier and the use of condoms, now let's go for the other artificial methods. And first on my list is surgery. Now this is for females and this is for males. Now for females, there's something you call tubal ligation. Is it that they tie the fallopian tube or they kind of cut it. Now I know that sounds scary, but this is only advisable for people that have no intention of giving birth to children. Possibly your plan was to give birth to 4 children, and you already have the 4 kids and you don't want any more kids, then you can just go for tubal ligation. So what happens is that since the eggs, the female eggs, are supposed to travel from the ovaries through the fallopian tube down into the uterus, once there's an obstruction so that the fallopian tube has been cut or tied, then there's no traveling, there's no fertilization, and no baby forms. You get my point. So the second one, which I said was for males, is what you call vasectomy, which I'll try my best not to use medical terms. So just explain it in layman's term, the pathway through which sperm travels out of the man's body into the female reproductive tract is going to be severed. I mean hot, really really hot. But most people don't really go for this method. It kind of sounds weird when you tell a guy that after this you're not going to be able to impregnate a woman or another woman. It kind of sounds weird, and most men don't really buy the idea, but it is also a method of contraception. So you already have the 2 surgical methods of contraception. Now let's move down a little bit to oral drugs. Now there are actually different types of oral drugs. I have some pills here, I have some here, I have some here, then I also have some up here. Now I'm going to be differentiating between the ones here are just hormonals, like the ones up are hormonals, and there are like two types. There is one that can only be used by women that are breastfeeding, and those ones are called mini pills. They have the combined pills, which can be used by people that are not breastfeeding. I hope you get my audience. Now, I'm not going to be giving out the names of this drug because I don't want you guys to be going over the counter to just get the drugs. This video is majorly for health education. If you want to get any of these drugs or implants or other things that I'll be discussing later in the video, you can always visit a family planning clinic in your area. It is actually free. The services are free. To insert, to get the drugs, condoms, and all, you give it for free, so you don't really have anything to worry about. The only thing you can really think about is your transportation fare to and fro the clinic. I'll be getting my gist now. Talking about the drugs, what they do is that the way you use these drugs is something that you have to use daily. These drugs, you have to take them every day, so it's not really advisable for someone that forgets things quickly to go for this method. If you know you can't remember to take your drug and you have to maintain the time, if you're taking it 8 a.m. every day, it has to be 8 a.m. every day. I hope you get my gist. So if you're the type that you forget stuff, you may not be able to use this method. Then you also have other pills which are actually emergency pills. Please note the word emergency. Some ladies and women tend to like abuse the use of these drugs because they feel, okay, it's for contraception, so I can use it any day, anytime. Now, these emergency pills, a very common one among most ladies that I know is the one you call Postinor. Now, Postinor is an emergency pill that should not be used frequently, and the reason Postinor and other emergency pills should not be used frequently is that they have tendency to alter your cycle, and they have side effects basically. And the most prominent one is altering your menstrual cycle. You could having your period coming like too frequently, like your cycle days become shorter or longer, or you don't even see the period at all, and that can be very, very disturbing. So emergency pills are only used for emergency contraception, while you have the mini pills and combined pills that are used daily. Please note that any family planning method that is hormonal or hormonal that contains hormone basically are not given to people that have high blood pressure, because it has the tendency to aggravate that high blood pressure. I hope you guys get my gist. Though if you go for family planning counseling in any clinic around, they're going to tell you more. So I'll just move on to the next one, which are injectables. Now, I hope you guys can see. Now, there are different types. This is one. They call it Depo-Provera. You have Nursingschool, and you also have another one called Cyanopress. I think I made a video of the poster earlier. I'm going to put it up so you guys can see. Now, the differences between each of these injectables are the duration of action. Now, for Depo-Provera, it's something that you have to take every 3 months, like 3 months interval. For Nursingschool, you have to take it at 2 months interval. Now, this one, you just have to come to the clinic on a specified day. They give you the injection. It's an intramuscular injection, just like any other malaria injection that I used to take. So it's not really a big deal. Just give the injection and that is it. It starts working, and you don't get pregnant even after sexual intercourse. So that is another method of contraception that is available that some of you guys may not know about, because I know a lot of you only know about these emergency pills and you guys don't really have a good knowledge of these things. Now, there are several misconceptions about family planning which I'm going to address after this video, so just keep on watching. So now that I've talked about the injectables, I've told you the ones you take monthly, twice month, 2 months interval, then there's another one for 3 months interval. There's also long-acting contraceptives. You have the implants and you have the intrauterine contraceptive devices. Now, starting from implants, now I'm really hoping you guys can see this. I'm trying to see. Oh, now these are, oh god, I'm sorry. Possibly I have to put up a picture like here so that you guys can see. Now, implants, they're going to be implanted like right under your skin, your arm. Yeah, it's as basic as that. They are like they are as thin as like what do the a matchstick. Yes, a matchstick would be the best way to describe them. In fact, some of them are not even as thick as some of those matchsticks that we have. So they are just tiny. They're about this size, and they're very, very thin. So those are things that are going to be implanted directly under your skin. Now, there are different types. There are ones that comes in 1 rod. There's some that comes in 2 rods. Now, the one of 1 rod called Implanon works for 3 years. So once you implant it, contraceptive function lasts for like 3 years, after which you can come to remove it and replace it if you still want to continue contraception. I hope you guys are getting my gist. While the other one with 2 rods, known as Jadel, would work for 5 years. Yes guys, it's going to work for 5 years. So once you put it in now, they're like 2 rods. They're going to like just 2 tiny like mastics here. They're going to put it directly under your arm, just like in plano, and it will be there, and 5 years you're all free from pregnancy and all that. Then you have another one known as intrauterine contraceptive device. It is right here. Yeah, this is it. And these are the implants. The implants are like right here. You can see 1 rod, 2 rod, then this is one on 1 rod. Then this is the intrauterine contraceptive device, which is going to be, now let me look for the best way to explain it. Now what it just does that it inhibits fertilization by blocking the pathway. You know, the womb is actually a very, very small organ. Actually, for those of us that don't know, it only expands when a baby is in it, and it's asked the nurse to expand when the baby is in it. But on a normal day, the normal uterus is like very small and it's in the pelvis. So the copper T is just like a tiny device that is going to be introduced via the cervix. Now what do I mean by the cervix? After the vagina, before you get to the womb or the uterus, there is a place called the cervix, which actually is more like the gateway, just like the gateway to your house. Now they're going to introduce that copper T through the cervix to block any possibility of contraception, any possibility of fertilization. So it is a method of contraception, and copper T works for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 years. Yeah, copper T is the contraceptive function of copper T lasts for like 10 years. So that's it guys. I think we're done. So I've talked about natural methods, talk about condoms, talk about implants, talk about injectables, oral drugs, and intrauterine contraceptive devices. So that's it guys. Those are like methods of contraception. Now coming to the misconceptions about, now talking about the myths about family planning, childbirth spacing, contraception, and everything we've talked about today. I'm going to be using this manual, which I also borrowed from the family planning clinic of my hospital, to like list out the myths and also tell you the facts about childbirth. So I have some that says that family planning methods causes infertility, cancer. These are all misconceptions. Okay, either you do family planning method or not, either you space your children or not. If you're meant to have cancer, you will have cancer, God forbid anyway. But if you're not fertile, you won't be fertile. It's not as if it's the childbirth spacing or thing that actually causes those kind of situations. What actually happens is that people feel that family planning methods causes infertility because it depends on the method. There are some methods that it will take a while for the body to return back to its normal process of functioning or normal physiology. Like let's just assume that something that has been implanted into your body for a number of years and your body has become accustomed to the effect of that thing. So if you're removing it, it might take a while for your body to readjust, and for some people body may readjust quickly. So it's not as if family planning causes infertility, and it's not as if it causes cancer or anything like that. People also believe that family planning methods causes you to gain weight or something. The thing is, naturally we gain weight like gradually over time, but if you feel that family planning methods makes you gain weight, you can easily come back to the clinic and tell the nurse or the healthcare provider that attended to you to just remove it, that you won't like stop. That's if you have an implant or an IUCD, whereas if you have an injection or drugs, you can just stop taking them, knowing fully well that there is a chance for you to get pregnant even though you do not want to have children at that particular moment. So that's it guys about family planning, childbirth spacing, and contraception. If you have questions and comments, kindly drop them in the comment section below. Please give this video a big thumbs up. It helps to promote my videos to people that need them. Don't forget to subscribe, and see you later guys. Bye bye.